everyone. Before I get started, I would like to read the disclaimer that you see on your screen. The PharmAssist virtual learning experience brought to you by Mandel's Clinical Pharmacy is intended only as an instructional program for patients. The clinic-specific information shared by the nurse is the opinion of the nurse and is not intended to replace the recommendations or the requests of your healthcare professionals. All the medications will be dispensed by Mandel's Clinical Pharmacy according to the prescription as written by the provider. So thank you everyone for tuning in tonight to the PharmAssist virtual learning experience. This is the first online live pharmacy medication instructional program brought to you by Mandel's Clinical Pharmacy. This educational program brings you together with outstanding healthcare professionals right from the comfort of your own home. I'm your host, Tony Newman. I've been a nurse for 10 years in the New Orleans area. My last 3 years have been in fertility. The PharmAssist takes place every Monday at 7 p.m. Eastern. Tonight, we will be providing a live medication instructional program on 3 fertility products, which are the Gonal F Rediject Pen, the Gonal F multi-dose vial, and the Avidreal. This will include a question and answering session throughout the program. Please join us on Zoom or Facebook Live, and we invite you to be a part of the discussion by sharing your questions in either format. Each week, we have a different healthcare professional from across the nation that will provide you with real-world experience, just as if you were sitting across from them at your clinic. Tonight, we are joined by Karen Hammond. Thank you again for taking your time and your interest this evening, and I'm going to go ahead and turn it over to you, Karen.
Hi, everybody. Thank you so much for that opening remarks to Tony. And if you're joining us live tonight, a special thank you for joining us at what seems to be a little bit of a later hour because of daylight savings time. I know if you're like me, you feel like it's already kind of late at night. But I hope this will be very worthwhile as I walk you through those 3 products that Tony mentioned. And we want to make this a nice, laid back, relaxed format for you. It's your chance to ask any questions that you have, and we'll be happy to provide you with some information. As always, if it's specific about dosages of your medications or any specific clinical information based on your personal care, then you can ask the general questions, but direct those specific questions to your healthcare provider. As Tony said, I'm Karen Hammond. I'm a doctorally prepared women's health nurse practitioner in Birmingham, Alabama, and I am the co-founder and IVF program director for an IVF program here in Birmingham, Alabama. So there are 3 products, as she said, I'm going to talk to you about tonight. And the first one is the Gonal F pen. It's one of the easiest medications to do because really you just take off the top, put on a needle, and dial your dose, and it's ready to go. This medication is follicle stimulating hormone, FSH. That's the active ingredient that's in the pen. And that is to do exactly what the name of it says it'll do. It'll stimulate your follicles to grow. And as you probably know, the follicles are the little cysts that contain the eggs. So we want those small little cysts to get bigger and bigger in response to these medications in preparation for either time to intercourse, an insemination, or an egg retrieval. So let's go ahead and cue up the video, and then we can talk about it a little bit further on the other side and answer any questions that you have. I'd like to talk with you about how to administer Gonal F using the Rediject Pen. If your prescriber has prescribed the Rediject Pen for you, it's very simple to give yourself the injection. When you take the pen out of the packaging, you simply remove the cap, and you'll see a dosing window on the side that tells you exactly how much medication is actually in the pen. Next step in preparation is to take one of the needles, and it comes in a little package where you just pull off a tab, and then the needle will screw directly on to the tip of the pen device. Next, you'll dial your dosage. And for today's purposes, we'll say the dose is 150 units. And you just dial that. You see it in the window. No worries if you go beyond it. You can just dial the pen back the other direction. Then take the top off of the needle. There's a big cap first. And then secondly, there's a tiny cap to cover just that tiny little needle. And to administer this, you give it subcutaneously. That means in the fat, generally in the abdomen or the outer part of the thigh. To do this, just choose your site first. If you want to give it in your abdomen, you should go someplace around your belly button, like where these little blue areas are, or either in the outer part of the thigh, anywhere really that you can pinch an inch. Then you pinch up the area because you want to make sure it's going into fat. You bunch it up a little bit, put the needle straight in all the way, and then depress the plunger. You'll feel it vibrate just a little bit as the medicine goes in. Then release the plunger, wait a couple seconds, and pull the needle straight out. And just like that, you've given the injection. After you've administered it, you want to carefully remove the cap remove the needle by putting the outer cap back on and untwisting it. Then you can dispose of it into a sharps container or protected device. Just drop it in there. If you look in the window after you're done, it'll tell how much medication you have left. And these pens are somewhat overfilled. So just because you've used what you think the total dosage is, take a look in that dosage window because you may have some extra that you can use. Then recap it and you can place it back on the counter until you're ready for your next injection. Perfect. How easy was that? So this is one of the easiest ways to take the medication Gonal-F. It is follicle stimulating hormone, as I said, that stimulates the follicles to grow. So what kind of indications might there be for being prescribed this medicine? Why might you be prescribed it, or why might you not be prescribed it? So anytime we want to stimulate the ovaries, this medication is a good choice. Some of those indications are that you have unexplained infertility. So you've had a complete workup and still no cause for your fertility can be found. So we can, in that case, cause more eggs to develop and either do an insemination, which puts more sperm closer to the target, so to speak, of the eggs, or we can retrieve the eggs and mix the eggs with sperm, or perhaps put a single sperm right in the middle of each egg. So those are just a couple of the indications for using Gonal-F, but this is probably the easiest way to administer it. Again, it's just a simple pen. Some things I particularly like about is the dosage window. Let's see, right there, where you can see the dosage right in the middle of the window. So you can confirm how much you've given, that really is what is prescribed. I used 150 units for the demonstration video just because that's a pretty common dosage, but it goes down to very, very small dosages. The smallest dose is 12.5, and I don't see too many people getting that tiny of a dosage, but for your particular reason, your healthcare provider may think that's appropriate. Another thing that I think is really important to know about this pen is that they are overfilled. So your dosage of your pen, how much medication is in your pen that's prescribed, can vary a little bit, but this demonstration pen that I have goes up to 900 units. I don't know if you can see that number quite right there where the plunger goes to, but there are 900 units in this. You can always look and see how much you have left. It'll look like just a tiny little bit if you look at just the liquid, but actually it's hard to tell just from seeing the liquid. So I'm really thankful that the folks at Serono put the actual amount that's left in the pen in there, so you can calculate if you do have enough to get by. So go by what you see in your window dosage, not just what's on the dosage on your pen itself, because what's in the window is how much you have left. So when you are taking this medicine, just take it out of the package, put your needle on, dial your dosage, and it's ready to give. So Tony, tell me what questions we have out there coming in.
Yes, so the first question we have is, what's the best way to store my Gonal F pen?
Perfect question. So when you get this, it may have been sent on a cold pack, so it may be at a cold temperature when you first get it. Once you take it out of the refrigerator and open it, it's good just sitting out on your counter for 30 days. So most stimulations don't last nearly that long. So once you're ready to take the first injection, I'd recommend you take it out of the refrigerator for half an hour, just to let it warm up to room temperature to give your first injection. And then after you do that injection, it's fine just to set it aside in a safe place away from children or animals until you're ready to give your next injection. So once you take it out of the refrigerator, if you're ready to use it, it does not have to be refrigerated again. Great question.
Yeah, so the next question we have coming in is, what if I dial up too much medication in my pen? Do I need to just waste that medication?
That's a great question as well. So with this pen, unlike with the Follistim pen, you just dial the dosage just by twisting the little knob on to the right of the dosage window. And if you see that you've gone too far, you actually can go backward even after you have the needle on. You can dial the dosage backward and it doesn't waste any medicine. I think this is liquid gold and I never want you to have to waste any of it. So it's fine to just go backward on the dosage and confirm and reconfirm that you're taking the correct dosage.
The next question that we have coming through is, can you explain a little bit more about the Gonal and FSH and how it works in a typical cycle?
Great question. So I love it when my patients ask me, why am I taking this medication and how exactly does it work? So our brains as females respond to low levels of estrogen that's in our bloodstream, and it signals to our brain to produce a couple of hormones, follicle stimulating hormone and luteinizing hormone. This medication is follicle stimulating hormone. And while those estrogen levels are low, it's pushing your brain to make more and more FSH. That kind of makes sense that the FSH is going to grow your eggs, and your eggs, as they grow and develop, will produce estrogen. So it's a nice little mix of your ovaries talking to your brain and then your brain talking back to your ovaries to help you to develop these hormones. However, when you take this medicine like Gonal F, what it does is it bypasses that feedback from your brain altogether and works directly on your ovaries. It is the FSH that your brain would normally make. This works directly on your ovaries to grow, develop, and mature follicles. So unlike some of the oral medications that you may have heard about or perhaps taken before, like clomiphene citrate or letrozole, that help your brain to realize that your estrogen levels are low, this bypasses all of that and just pushes your ovaries directly.
All right, Karen, this one's a challenge. What are some of the main causes of infertility, and why would I need to inject FSH in the first place? That's a great question.
It is a great question. You know, there are many causes of infertility that we know of. There can be problems with ovulation. So your ovaries just don't grow and mature follicles like they should, or ovulate the eggs like they should. This medication can help push your ovaries a little bit. It could be because you have problems with your cervix, that your cervix doesn't make a sufficient amount of cervical mucus, so the sperm don't have a way to swim through your cervix, through your uterus, and out into your fallopian tubes. This medication kind of indirectly improves your cervical mucus because it causes your estrogen level to get higher, and estrogen is the hormone that helps to produce clear, watery, abundant cervical mucus. Could be a problem with your uterus. This medication doesn't really do much for your uterus, except as your lining grows, as your estrogen grows, the lining of the uterus, the endometrium, also gets thicker. Could be a problem with the fallopian tubes. And in that case, in vitro fertilization or intravaginal culture is going to be what's recommended for you. And that is benefited by having more than a single egg to retrieve. So you may be given this medication or this medication in combination with an oral agent, or maybe with Minipure, a drug that contains LH and FSH. But for IVF, this is a very commonly prescribed medication. And the other reason that we know about is male factor infertility. And weirdly enough, the way we treat male factor infertility, by and large, is by super ovulating the woman, making lots of eggs for the woman, and either doing an insemination or some form of in vitro fertilization or intravaginal culture, like we mentioned. So this medication can play a very critical role in the treatment of multiple types of infertility.
Sorry, I was still muted. I don't see any more questions on the Gonal-F pen, but since we're going to switch over to the vial, we can kind of add any questions that people might have on that one. So do you want to add anything before we move on?
Yeah, perfect. So the next medication we're going to talk about is actually the same medication, but it's just a different way that it is provided to you for administration. So this comes in a pen device, and the next one you have to mix a little bit, but there are some advantages to it that we'll talk about. So Tony, if you want to go ahead and load it up and get it going, then I'll get going as well. Your prescriber has recommended you take Gonal-F multi-dose. It'll come to you in a box like this that has all of the things that you'll need to give your injection. I'd recommend you begin by choosing your injection site. This medication is administered subcutaneously, which means it goes into the fatty tissue of either your abdomen or your outer thigh. I generally recommend people take it beneath their belly button, outside an inch or two, beneath and out, or in the outer part of the thigh. Really, this medication can be administered pretty much any place on your abdomen or your thigh where you can pinch an inch just to make sure that it goes into the fatty tissue. Next, open up the box, and the inside will look like this, where there are syringes with needles already attached, a syringe with liquid, and a vial that has powder in it. The powder is actually the medication. To give the injection, just open up the packaging, remove the vial and the syringe with fluid, and take out just one of the syringes that has the needle already attached. Next, you'll remove just the top off the vial by gently lifting it up. Then take the top off the needle that's attached to the syringe with the liquid in it. Put it into the middle part of the vial, into the rubber stopper, and push in all of the liquid. And it will quickly dissolve all the powder that's at the bottom. Remove that syringe and discard this into your sharp container to avoid injury later on. Then you can open up the needle and syringe. Remove the cap from the needle, and again place the needle into the midpoint of the stopper, and you're ready to withdraw your medication. Your prescriber will tell you exactly what dosage is best for you, but for today's instruction, I'm going to suggest that your dose is 150 milligrams, 150 international units. You just pull back to 150 on the syringe. If there's a little air in there, no worries. And it's ready to administer. Then you want to choose a place on your abdomen to give the injection. Wipe it one time with alcohol and bunch the tissue up. Remember, you want to pinch an inch. Then take the needle, put it straight into that area all the way, Push the medicine right in, release the skin, release the plunger, and pull the needle straight out. If you notice a little droplet of fluid or blood on the area where you administer the injection, no worries, just wipe it with an alcohol pad and cover it with a bandage if you need to. When it's time for your next injection, you'll do the same thing, but the reconstitution is already done. You'll simply just take the vial, withdraw the same amount that has been prescribed for you, and administer it just like you did before. Some people opt to alternate sides or sites when they're giving the injections. Keep in mind that the vials and the multi-dose Gonal-F are overfilled, so you'll have more medication than what's actually printed on the bottle. Don't waste that medication. You can still use it. If you have any questions, you can always ask your healthcare provider. But congratulations, you've now given your Gonal-F injection. So that's pretty easy too to give the medication that way. A couple little hints about using the multi-dose is it does come with about 150 units of overfill. So if your dosage is 150 units and you get a 450 pen that you think just has 3 dosages in it, it'll actually have 4. So I love the way that this is so nicely overfilled, just so you can kind of get the most for your money. Where I practice, not a lot of people have insurance coverage for their medications, and this is a huge help to have that significant overfill. You do have to mix it, but it's so easy, and you just have to do it that one time per box of medication that you have. The next time you give it, you just take one of those needles and syringes. It's already hooked together. Draw out your dosage of medication. I do recommend that you wipe it off one time with alcohol just on the rubber stopper of the vial before you put the needle in to draw it up. And you can save that same little alcohol wipe and use that on your injection site. It's very easy to do. Don't fuss with or worry with the if there are any air bubbles in there. As I like to say, only on soap operas is it instant death if you give yourself a little bit of air. In fact, if you put the needle in and pull back just a little bit, you're most certainly going to get a little bit of air just from withdrawing once it's in the injection site. No need to do that, but giving yourself a little bit of air is not going to matter at all. In fact, if you pull back to just one of the tiny little short lines when you give this before you give this medication, then that will put just a little bit of air behind the medication and keep that tiny little drop from leaking out. So you might get even more of a full dose when you do that. So Tony, tell me what questions we have so far.
So you kind of touched on this a little bit, but the question we have is, I've heard the overfill vial can save me some money. What does that mean, and how exactly does that work?
Great question. So I think of this medication as a ballpark for being about $1 a unit, maybe a little more, a little less. But if you think about that and you get a vial that says there's 450 units in it and you pay about $1 a unit, but you're really getting 600 units in there, then you can see that that's a quarter more medication that you're getting kind of for free. So that's how it can save you money. A little bit of work, but it's easy work, as you could see from the video, and mixing it up. But I think it's well worth it.
Okay, the next question we have coming in, what are some reasons that my clinic would use the vial versus the pen, or vice versa? And then how do you choose which one to use in your clinic?
You know, I think these medications can be used interchangeably because it's the same exact medication. It's just different formulations. So when I am making a decision of what to prescribe in our program, I look at the dosage that has been prescribed for that individual patient and see if it's going to be more advantageous to get that extra 150 units. So if a patient's only taking, for example, 75 units a day, and my best estimate is going to be that she's going to take it for 4 or 5 days, taking the multi-dose vial is probably not the most cost effective for her. Maybe a 300 pen would be better. So your provider and your healthcare team will help you to work out what they think is going to be most cost effective and most advantageous in that respect when they make the decision as to which medication or which formulation for administration will be best for you. If you think one of these sounds like it would be better to meet your needs, be sure and we want your input. Be sure and talk to your healthcare providers and the healthcare team and let them know what your thoughts are. And your input's valuable too. They'll definitely take that into account.
This is a good question that we get often. I've had it today in clinic, actually. What are some of the side effects that I should be aware of with Gonal-F?
Great question there too. So the biggest side effect people notice while they're taking the medication is that they can start to fill their ovaries. You know, I said that this, the FSH that's in Gonal-F causes the ovaries to grow, develop, and mature the little cysts that contain the eggs. Well, as those get to be bigger and bigger, the ovary gets to be bigger as well. So one of the first things you may notice is when you walk, it feels like something's jarring around. If you think about drinking a lot of water and then you walk around, you can almost feel it sloshing. Well, it's kind of like that, but just down much lower, right around your ovaries, just above your pelvic bone. It may feel your pubic bone. It may feel like you can feel the ovaries jarring a little bit. What most people will say is that they have just a heightened awareness that their ovaries are there and something's going on. To me, I think this is a really reassuring sign. It gives you confidence and comfort. Yes, this medication is working. As they get to be bigger and you get closer to the time that you'll get your trigger shot, we'll talk about that next, closer to the time of ovulation or your egg retrieval, it may become a little bit uncomfortable just as your ovaries get bigger and bigger. I guess the biggest risk to this medication is going to be after you've taken the trigger shot. A few days later, after you ovulate or have your egg retrieval, your ovaries will initially be drained of the eggs and the fluid that are in those little cysts, but they refill and re-expand and actually get bigger than they were before you ovulated. So you may have even more of an awareness of your ovaries being enlarged. And sometimes you can have some of that fluid seep out into the abdomen. We call it free fluid, where you get to be more than uncomfortable. It can be painful. And you can develop this condition that we call ovarian hyperstimulation syndrome. It's where your ovaries get bigger and bigger. You have that fluid shift from inside the cells to outside the cells. On occasion, people can have nausea, vomiting, diarrhea, may even have to be hospitalized. And there are a handful of deaths that have been reported worldwide. But the good thing for you is that your healthcare providers are keeping a close check on it. They are going to monitor you frequently, tell you what they think is the best thing to do. And as healthcare providers, we have a keen interest in keeping you healthy and safe so that you can have your baby and have a nice, safe, healthy pregnancy and delivery. So even though there are risks to these medications, most cases, the risks are going to definitely outweigh the benefits. And keep in mind, there are risks to taking any medications. If you really want to be afraid, read the package insert that comes with Tylenol or aspirin and see what all the potential side effects are for taking that. Every medication has risks. Don't let that deter you. Your healthcare providers will be with you every single step of the way as you take this medication, and we'll do everything we can to minimize any risk for you.
Okay, I don't see any more questions on Gonal. I think we've double covered it tonight. So if you're ready, we'll go ahead and move on to Avidreal.
Perfect. So Avidreal is the third medication we're going to talk about tonight, and that is what many people will call the trigger shot because it triggers or it pushes ovulation. Avidreal is, it's actually HCG, the same hormone that you make when you're pregnant, and the HCG actually mimics the LH surge. So if you've ever used home ovulation kits, with taking oral agents or maybe in a cycle without taking any medications at all. You'll watch for the LH surge. It's going to give you a little advance notice of when ovulation is. This medication mimics the LH surge. So after you take it, about 40 hours or so later, within about 40 or so hours, you will ovulate. So either we're going to time a procedure for an insemination or a procedure for an egg retrieval based on when exactly you take the HCG. So this is one of the medicines. The others we tell you to take in a ballpark range. Take it in the morning, take it in the evening, whatever your provider recommends. But the Avidreal or the HCG, we're going to give you a very specific time to take it so we can very carefully and precisely time that procedure. So Tony, if you want to go ahead and roll the video, then we'll answer some questions. I'd like to talk to you about administering Avidreal. If your prescriber has recommended you take Avidreal, chances are you were told to take it at a very specific time. Good news, it's very easy to give this injection. The Avidreal comes in a little package like this, and you simply open it up and remove the inside part like that. Fortunately, with this medicine, it's in a pre-filled syringe, so the medication is already drawn up, mixed, and ready to administer. You just pull the plastic tab off and then choose the site that you want to give the injection. Since this is a subcutaneous injection, that means it goes into the fat. Most people recommend that you take it beneath the belly button, out to the side an inch or two and down an inch or two, or either in the outer thigh. Once you select the site to give the injection, you can use an alcohol prep just to gently wipe the area. So you bunch up the tissue, wipe the area once with an alcohol prep, remove the top from the syringe, and then put the needle straight in, all the way, depress the plunger, release the tissue, release the plunger, pull the needle straight out. Afterwards, you should put the needle and syringe in its entirety directly into a sharps container to avoid getting stuck with it. Congratulations, you've now given your first injection of your Avidreal. Perfect, that is easy peasy. Everything's already drawn up. It's the one dose for everybody with that one. So you just open it up, choose your site, and administer the injection just into the fatty tissue. Easy, easy injection to give. The most important thing about Avidreal or any trigger shot, any formulation of HCG, is that you do it right on time, just at the time that you've been recommended by your healthcare provider. Because, as I said earlier, any procedures are going to be timed precisely based on what time you're told to take your HCG. If you're 10 or 15 minutes late or early, it's not really a big deal. But if you have to take this in the middle of the night, it might be a big deal if you oversleep and you're a few hours late. That's one of those times that you need to absolutely for sure call the after hours number for your program and speak to somebody to see what exactly you should do. Most practices don't offer to do egg retrievals at night. So if you're off by 12 hours, that might mean instead of a daytime retrieval, you might need a nighttime retrieval. And so your cycle could be canceled. These days, with all the different options of alarms and alerts with your cell phone, your alarm clock, with Siri and Alexa and everybody else, most people are really, really good about taking it right on time. I have had people that have taken it too soon or too late, and sometimes we do have to cancel those cycles, but I know your team wants to do everything that's absolutely the best for you and within reason, so they may be able to adjust your retrieval time. I know personally, I had somebody that took their HCG 12 hours off. And so we ended up doing at 9 p.m. egg retrieval. Some programs may not be able to have that flexibility. So try everything you can and every kind of little stop you can to make sure that you do take it right on time. So what other questions are there?
All right, so one of the first questions that we have coming through, why do I need to use Avidreal as part of my treatment cycle? Would I not ovulate on my own?
That is a great question. So when we are super ovulating your ovaries, when we're growing eggs, sometimes your estrogen can get to a point where it will block you from ovulating on your own. Sometimes you are prescribed medications like ganirelix or cetrotide that will keep you from ovulating on your own. And if we're timing a procedure very precisely, the HCG gives us that really specific window that we can time it accurately. Otherwise, if we're trying to chase when you're going to ovulate on your own, we may miss it altogether. You may not ovulate on your own, or you may not ovulate until your eggs are too big or post-mature. So for all these reasons, Avidreal, or actually any formulation of HCG, is going to be recommended anytime you're taking an injectable kind of fertility medicine like Gonal-f, Follistim, or Menopur.
Is there a chance that my trigger shot wouldn't work to cause ovulation? If so, what are my options if that fails?
Great question. So the only reason that I know of that HCG is not going to work, any trigger formulation is not going to work, is if you fail to take it. This one is pretty foolproof since it's already mixed and you just have to administer the medication. Some of the others that you do have to mix, there can be a concern with that because if you're taking it in the middle of the night, you may not be thinking as clearly. I have had people forget to mix it with the powder and just take the liquid. And the ones you have to mix, the powder is the medication. The liquid's just something to dissolve it in. So those are the real reasons that people can have failures of the HCG. And it's generally inaccuracies in preparing the medication or administering it. Don't worry about those things. Focus on what your specific instructions are for your specific medication. You've got this.
Okay, so I see another question coming in. How many follicles are we hoping to have at the end of my treatment? What size follicle would be preferred? That's a good one too.
Oh, those are great questions. So how many? Well, that depends on what you're doing and what your stimulation protocol is. So if you are having your ovary stimulated to do an insemination, where you're going to ovulate whatever's mature, and whatever ovulates could potentially make a pregnancy, you're going to want fewer to be big than if you're doing IVF, where we retrieve the eggs and we fertilize them in the lab before we put them back into your uterus, and we can control how many embryos end up in your uterus. So that being said, we want to minimize your risk of having more than one baby. So it could be as few as just one or two, or we could want you to have a dozen or even more, based on what the cause of your infertility is and what the type of the treatment is. Now, everybody measures follicles a little differently. Most people say that a mature follicle should be about 18 millimeters to 20 millimeters, but your healthcare provider has the consistency and experience within their practice to make sure that you fall right within what they think the normal range is. In my program, I want to have at least one or two follicles that get to be 18 millimeters before we give the HCG trigger.
All right, I don't see any more questions coming in, so I think we could probably close it up. If you have anything else you want to add for this evening. Perfect.
So I want to thank you all for joining us tonight, especially since it's right after the big time change and everybody feels like it's myself included, it's a little bit later than it really is. But these medications that I've shown you tonight are very, very easy to do. I think they're the easiest of all the medications that have to be injected. The three I was fortunate enough to talk with you about tonight are the absolute easiest. They can be paramount in the success of your treatment, and they're pretty foolproof when you go to administer them. Have confidence in yourself. Once you get all of your medications shipped to you from Mandel's, open up the box, see what you've got. Whatever needs to be refrigerated, stick in the fridge. Whatever doesn't, put in a safe place that you remember where it is, and kind of familiarize yourself with the needles and syringes and the medications. The folks at Mandel's are amazing at labeling every package of needles, syringes. They even put in the alcohol wipes and the sharps containers, everything that you're going to need for your medications. And the way the medications are prepared by the manufacturers are also to make it as easy as possible for you to administer these medications. Always remember the folks at the pharmacy are more than happy to answer any questions that you have, or please reach out to your healthcare provider. We are in this with you. We want this just as badly as you do, and we want to make it just as easy as we possibly can. If you still feel a little bit uneasy when you look at all the medications and you've had your injection training, just take the whole box with you when you go in for your baseline ultrasounds. We'll be happy to help sort them out and make sure that you are 100% comfortable with them. We're all on the same team, and we definitely all have the same goal.
Yes, thank you, Karen. I want to thank you for your time and expertise tonight. Thanks to everyone who joined us on Facebook and Zoom. We hope you were able to learn something tonight. And hopefully, if you didn't ask a question, we, said something that, triggered you to learn something tonight. As a reminder, these videos, as well as the product demonstrations, are available on our page, the Facebook page, and the mymandels.com PharmAssist page. We believe that repetition leads to retention. So the more you see these, the easier they'll get. You have all these great resources, so definitely utilize them. And again, like Karen was saying earlier, reach out to your clinic nurse, your staff there. We're always willing to answer the questions for you. We look forward to seeing everyone again next Monday night at 7 p.m. Eastern for another great program. Please share this program with anyone you think can benefit from it. And everyone have a good night. Thank you.
Thanks, y'all. Good night.
Bye.